So these are going to be the clinical symptoms are going to be just now discussed. Is a pyrexia, is increasing the temperatures, localized tenderness in the right iliac fossa, and as a muscle is going to get the guarding. So that means that if we do any movements, they're going to restrict because of the pain. So they can get the movement, but the patient is going to restrict the movement. So that is called as the muscle guarding. And also rebound tenderness. Rebound tenderness means if you press, this one, if you press on the abdomen, so if you suddenly take out the pressures, so they are going to give the more pressure in the abdomen regions. So this is the common sign of the appendicitis. So these symptoms we can found during the physical examinations in the appendicitis. So these are some clinical investigations. The physical examinations, the signs are going to be, we are going to find the pointing signs and also Rowan signs, Soho sign, and operator sign. So these signs are how we are going to identify these signs. So this one is the first one is the McBurney point. So this McBurney point, so what is the McBurney point? So that is nothing but where exactly in between if you draw a line perpendicular to the like a ASIS anterior superior iliac spine to the umbilicus, so where the line is going to be intersect, so there the pain is going to be the severe. So especially, so it's the right iliac regions, the pain will be there. So this point is called as the McBurney point. If the patient complains, so because of the location of the appendix will be in the McBurney point. So because of the pain is going to be radiate from the here to the umbilicus. So that is the reason umbilicus in the right iliac regions, but the pain is going to be distributed around the peri-umbilical region, surrounding the umbilical regions. So the pain is going to be aggravated during the cuffing, or maybe if any excessive movement, so the pain is going to be increased. So if you palpate these McBurney points, so if it's going to be like a clockwise and also anti-clockwise, so the pain is going to be more, they're going to feel at this right iliac fossa, so it's indicating this acute appendicitis. So this is called the McBurney's point. So coming to this rebound tenderness, so this rebound tenderness is the clinical sign which there is a pain upon the removal of the pressure rather than the application of the pressure in the abdomen. So while palpating like in the abdomen is one special technique, palpation of the physical examination of the abdomen. So if we remove the pressures, the patient is going to get the severe pain. While applying the pressure, so they won't get much like a pain, but if you remove the pressure and palpations, so the patient is going to get the pain. So that is called the rebound tenderness. So next one is going to be the rousing signs. So these rousing signs are going to be, so in case of while doing the deep palpations over the left iliac fossa, the pain will be in the right iliac fossa. So during the palpation, if you palpate from the left side of the iliac fossa, if you palpate from the left side to the right side, so if you give the pressure to the left side, so they are going to get the pressure inside the right side. So this is because of the continuous palpations. So it's going to because of the pressure, or this if you give the pressure in the left side, so because of the pushing of these internal organs, so the pressure is going to be increased in the right iliac fossa. So it may give the pain in the right iliac fossa. So this is this is called the rousing signs. So this is the clinical signs. These are the important clinical signs to investigate the appendicitis. So another investigation, other special test for the appendicitis is going to be the Soho sign. So Soho sign is going to be, we have to check this is a special test to identify the appendicitis. So the patient position should be in the sideline positions, and also if the position should be, for example, the patient in the sideline in the left side, so because of the right leg should be in the extension positions, in the hip extension positions. So why we have to bring it to the extension position means, so the psoas muscle is going to be, the main action of the psoas muscle is the flexion of the hip. So if you bring them into the extension positions, so the psoas muscle is going to get the rest, like a stretch. So because of the stretchings, so it may disturb so it may use the irritation in the right iliacal regions, in the iliac fossa. So it may use the positive symptoms. So that's the severe pain in the right iliac fossa. So it indicates the acute appendicitis or inflammation of the appendix. So the suggested inflamed appendix is located along the course of the right psoas muscles. So if you do the extension of the hip, so this muscle helps in the hip flexions. So if you do the opposite directions, this may give the severe pain. And also we can modify this test, this is Sova's test, or otherwise if we give the resistance to the hip flexion. So if you ask the person to do the hip flexions in the sideline positions, so and also may chance to get the severe pain. So because of the irritation of the psoas muscles. So this also the positive test. Two types we are going to do the psoas test. We are going to bring the leg into the extension of the hip, as well as if we give the resistance to the hip flexions. So these tests are indicating the is appendicitis. And also next sign is going to be the Dunphy sign. So Dunphy sign is nothing but if the patient is involved voluntarily, if they cough, so the pain is going to be in the abdominal walls. So it's going to be increasing. The pain is going to be aggravated. So this sign is indicating the appendicitis. So this also another sign. So if we ask the persons, so what sign? As well as if you ask the persons, if you voluntarily cough, if they cough, the pressure is going to be increased in the intra-abdominal pressures. So because of the increased abdominal pressures, it may irritate this appendix in the right iliac fossa structures. So it may give the severe pain. And also another sign is going to be the obturator sign. So this obturator sign also, so the patient should be in the supine lying positions. So that also he can make them into the 90 degrees of the hip flexion and 90 degrees of the knee flexions. So if you do the internal rotation of the hip, so that means if you pull the leg away from the body, so it's going to be the head of the femur is going to be rotated into the internal side, that's the internal rotations. So because of the internal rotations, is going to give the irritation to the obturator muscles, and also is so who are having the pelvic positions, so it is going to get the irritation in the appendicitis. So it indicates any pain indicates the inflammation of the appendicitis. So these are the classical signs of the physical examination signs of the appendicitis. So obturator sign, Sova sign, and also the Dunphy sign and Dunphy sign, and next one is the Robinson sign. So these signs are very important to investigate to identify the appendicitis during the physical examination.